Spotlight series that continues on until the middle of November. Just a couple of pointers before we start off, that the session's been recorded and will be available on the Resource Hub afterwards at the link provided there. We're going to have Q&A at the end, so please post any comments or questions in the chat. Most of you who have been joining every week will know who I am now, but I'm Mark Kelly. I'm currently on secondment with the HEA as a National Policy Advisor on Education for Sustainable Development. So this week we're delighted to have the Royal College of Surgeons in Ireland sharing some of their ESD practice. So without further ado, over to Catherine.
Okay, so I'm just really quickly going to give you an overview of Education for Sustainable Development here in RCSI. So quickly just around the external drivers for ESD here in RCSI. Obviously we have the UN Sustainable Development Goals, which is the framework for people, planet and the future for the planet, but so that's one of the frameworks that we use within RCSI that's creating an external driver for us. Also, there's a second national framework for education for sustainable development by the Department of Further and Higher Education, and we respond to reporting on that. Also, our professional regulatory bodies such as IMO and CORU and the Pharmaceutical Society all have a sustainable criteria within their accreditation policies and procedures now. But actually, probably the greatest driver from outside of RCSI for integrating sustainability and climate health into our curriculum is the fact that that the climate crisis that we're currently living through is actually a health crisis as well, and this is well documented by researchers and clinicians across the world, and called out most recently by the World Health Organization. So that has been a great driver for change within RCSI, because it's needed and required and asked for by our students, staff and patients across the board. So our commitment within RCSI starts first of all with our institutional strategy. So that was developed in 2023 and lasts until 2027, and innovating for a healthier future. So sustainability, the SDGs and the community are all called out as one of our areas for commitment. Also, our learning and teaching assessment strategy refers to the SDGs and sustainability. It's kind of ingrained throughout it. Both of these policies, strategies, reinforce our commitment to sustainability and partnership and making an impact locally, nationally and internationally here in RCSI. Operationally, I suppose this is really done through our Sustainability and Climate Health Committee, and that oversees the implementation of the sustainability strategy, and it integrates planetary health and across our education, research and operations. Within the Sustainability and Climate Health Community, we have 4 working groups, one for education, research, another one for research, another one for net carbon zero and green campus, and the kind of campus operations is the final one. But the education working group obviously works on integrating planetary health and sustainability into our curricula across medicine, pharmacy, physiotherapy and dentistry. And at the moment we're in the middle of a project using the UCC model for aligning our current curricula to the SDGs. We've started on medicine and pharmacy, and we're quite a way through that at the moment, but we're going to be starting before the end of the year on physiotherapy and dentistry as well, and we're hoping that that'll kind of enhance our sustainability outcomes and student competencies going forward as well. And then I just want to bring your attention to a really big project that RCSI was working on and is currently working on still, which is CHIME, and that's the Climate Health and Medical Education, and that was established by one of our profs, Debbie Stanstreet here in RCSI in the School of Population Health, along with her colleagues, and Ross is one of them. He'll be speaking to you now in a few minutes, but in conjunction with the Irish Doctors for the Environment. And the purpose, or the main work of that, was to bring together in partnership all the medical schools across the island of Ireland to integrate climate change, ecological instability and sustainability into health professionals' curriculum. curricula, and that has been a great success so far, and it's certainly been worked into the RCSI curriculum, and it's in the process of going through other universities as well. And just on a side note to that, before I hand over to Ashley, my colleague, RCSI has not been included in the SATL funding that other universities have been for the last 2 rounds, and it's just that we've done everything kind of within RCSI in great partnership across the different schools and with our colleagues across Ireland as well. And we've been working really hard to get education for sustainable development throughout the curricula, and we're kind of doing it from the bottom up and the side and the top down and everything, every way we can. So we're working really hard at that. So I'm now going to pass you over to my colleague Ashley O'Leary, who's going to tell you about planetary health and sustainability in the School of Pharmacy.
Thank you very much, Catherine. Thank you, Mark, for inviting me over today. So I'm just going to talk about sustainability in the pharmacy curricula. So overarching focus of the school, obviously, of pharmacy and the whole of RCSI is SDG 3, good health and well-being. And more recently in the pharmacy curriculum, we have, this is the 3rd iteration of a standalone elective module on planetary health and sustainability for pharmacists. But also I want to demonstrate some of the ways that I've integrated it and woven it into my other teaching, be it clinical and otherwise. And as Catherine said, there is a module mapping initiative underway to actually enhance that process. Okay, the context, I think, is quite clear. Healthcare delivery, despite its huge benefits worldwide, is also associated with a significant ecological footprint in terms of greenhouse gas emissions, generation of pollution. I'm particularly concerned, of course, about plastics. We generate millions and millions of tons as healthcare professionals every year. And of course, that's the endocrine disrupting agents and all of that waste as well that is generated across the spectrum from primary to secondary care. So this has led Seamus O'Reilly's group in Cork to describe it as the climate toxicity of healthcare, but I always think we should always have that plastic viewpoint as well. So it's essential our current and future healthcare practitioners are cognizant of sustainable healthcare practices. And so they require education on environmentally conscious pharmacy practice in the school. But also I think it's far more than just the knowledge, it's the eco-literate student that will drive this into transformative action for planetary health. And this has been called, we have been called as clinicians. This is Geoffrey Braithwaite from Australia and Philip Crowley from the HSE has said that we as clinical clinicians have a pivotal role to play. So my approach has been not through the ESD perhaps, but more through the planetary health education framework. And if you can see this diagram here, which is, shows at the very center of this is interconnectedness with nature. But also then you'll see those other types of things such as movement building and systems change, equity and social justice, and then systems thinking and complexity that I've heard multiple times at these spotlights. So it's very, very similar. And the approach that I've taken is multimodal, various different types of teaching approaches, active, experiential, PBL, CBL, but also service learning and situated learning. And the one thing that I've found in the last number of years, and I've been doing it for, around planetary health for longer than the 2 iterations, is learning from the students and learning with the students as well. So what we're really trying to do is this concept of agency, driving an environmental sense of purpose. So the standalone themes are naturally the impact of the Anthropocene and planetary health, that interconnectedness is highlighted. We also as individuals have a role, so the ecological footprints of daily living, and then of course broadly addressing the adaptation and mitigation strategies that are required to reduce the carbon and ecological footprint of healthcare and medicines use. And I draw out the need for pharmacists to be advocates and active participants in sustainable healthcare now and in the future. So pivotal to all of this, we know this is Carlos Ferron Guzman and from the Planetary Health Alliance. This is the structure around which I actually get from what are the underlying drivers, the environmental changes in terms of the Earth system boundaries, the 9 planetary health boundaries, and then the health impacts, because we know that interconnectedness between planetary health and human health is inextricably bound together. Next, please. Okay, this is just to demonstrate that there is a huge link between what's happening to the environment, but also what's happening in health. So I draw this because students, when I get them in second year, and certainly further on, have done cardiovascular, they've done respiratory medicine. So linking air pollution, but also that extra bit linking plastic, the effects of plastics, microplastics and nanoplastics to actually what can occur. Cardiovascular events can be increased, but also there's a huge link as well with cancer and epigenetic changes as well. So the most vulnerable are most affected. So these are points are drawn from the very beginning of the module and across all of the other teaching that I do, the inequalities that abound in this. This is just to show you the waste from one patient here on the left that was delivered to a pharmacy a couple of weeks ago, and of course all the plastic that we consume in delivering healthcare services. And it was shown last week, actually, from the Mullingar, I think, or Athlone, the 4 principles of sustainable healthcare are the pivot from which I actually just stick everything. So you can see here, I would have case studies across all of my teaching on prevention, self-care, lean service delivery, and low carbon alternatives. So you can pick and choose and do all sorts of things here, but actually always drawing on these, okay, promoting lifestyle interventions, you know, self-care, the importance of this to prevent use of healthcare down the line, to prevent the use of medicines which have a large carbon footprint. And then, you know, mentioned last week as well was low carbon inhalers. We would do case studies in that. So I marry that to the cases in the respiratory module and cardiovascular module, be it whatever, heat sensitive disease, you know, for instance, and also in terms of diabetes. So the outcomes are there in terms of delivery of sustainable healthcare, preventing disease occurrence, optimizing health outcomes, but reducing overuse and the benefits then of reducing costs and the co-benefits in terms of health as well. And what I do to do this, I've developed a suite of clinical and non-clinical vignettes. You see here, there's one on prevention, self-care, and the need for low carbon prescribing and non-pharmacological or social prescribing. This is just to demonstrate that the one on the right then is that the vulnerability, that students have to write the stories of these types of things. And also then you can bring that to the process of delivery as well, how things have to be resilient. So in HIV care, that care isn't disrupted because of the potential for resistance to occur, but it also focuses on inequities. So the other teaching and learning strategies that I would use are these interactive little pieces, looking at air quality indices, hunger maps, teaching about green chemistry, and also situated learning where we go on field trips. The students must do some project work together to present, usually on their own individual footprints, and to some of them it can be absolutely eye-opening. We also draw on guest lecturers when appropriate, showing the transdisciplinary nature as well, and also from a methodological point of view, I inform them as to how to conduct sustainable QI initiatives, were they in practice, and we can use various types of things that have been published. So the assessment for this current year has grown from what I originally had was a reflective piece, but now personal challenges, individual challenges. We're going to quantify the savings that we make by giving up something or doing something. And then I'm also initiating a group project, which is focusing on sustainable campus initiative. So we're going to do that over the next 5 weeks or so. So it's multimodal as well in terms of assessment. This is the type of feedback, you know, you're going to have these slides anyway, but they have really thought about it. So this is that engagement and that the recognition that they have a footprint and that they must do something about it. And they really are concerned. And that's the important thing, to get over those concerns through action is really important. I stress that continuously throughout the teaching I take. So the other teaching, you know, I integrate it, I weave it in. Everywhere there's cases, I put in the environmental risks, you know, environmental consequences along with social determinants, should I say, social, behavioural, etc. I bring it into my non-clinical teaching. I do health technology assessment. So where does environmental assessment of drugs come into the reimbursement decision making? How can we make that part of it? And in global public health, they're all about social injustices, environmental injustices. This is all now embedded across all of this. And one of the things that I've also done is actually started to do more in terms of the assessment to make it more positive, make engaged. So this is the first time I did a student partnership assessment. We co-designed it together, focused on some activity of action, self-care or communication, and also importantly tapping into their creativity. I found that that's really, really important, and then adding then a reflective piece. And these are just some of the submissions that I got earlier this year. So this is just one of my students. Every week he comes up to me with a different picture about sustainability. And this is one of our international students, and the imagination that they have and the actual attention to detail is lovely to see. So the other thing then, we have done it for our Year 5 students. They've done waste audits, an inhaler audit. We have a PhD student, Stephen Walsh, actually looking at doing a PhD on primary care carbon footprint and ways of mitigating it. And we have our first publication out and 2 to come, and then we're going to be getting a toolkit together. And also the fact that I and Stephen are involved in external ways development of medicines use greener framework recently for the HSE has been hugely beneficial, and we can bring that to back to the students to show that they the actions that are being taken. So if I were to map in a fishbone diagram what I do, my teaching, and what's being done in the School of Pharmacy, you can see radiating up from the planetary SDGs to all the others are included. So the key learnings for me are that there has to be a pedagogical shift. I'm so used to teaching science. I'm used to teaching standing lecture, theatre for 40, 45 minutes, whatever it is, and imparting knowledge. So that has to be shifted. Less slides, more engagement, more project work, really focusing on, all that complexity, the systems thinking and movement building. The range of class activities are challenging, but it's really rewarding to see active student engagement. And I suppose my final thoughts would be that education for sustainable healthcare requires inclusion of affective learning outcomes, really, really important, in addition to the cognitive learning outcomes with a focus on values, because values are essential to achieve transformative and long-lasting change among our current students and our future healthcare practitioners. And the other thing is, it's important to draw from the successes we achieve to provide students with the hope and impetus that can also make a difference, be it individually or collectively. Thank you very much for listening. So I'm going to hand over now to Ross, I think, in the School of Population Health, who's going to talk about the medical programme. Thank you.
Hello, everyone. Thank you, Mark, for the invitation, and thank you all for joining us. So I've been invited today to discuss the integration of sustainable development into our RCSI medical curriculum, and in particular what we do in public health and epidemiology. I guess a brief interlude is an overview of how our medical curriculum has been revamped or changed. So no longer is it followed a traditional block module by structure. Instead, we use system structures where one group, such as us, public health and epidemiology, won't teach at one point of time through the curriculum. Instead, we'll teach throughout all of the taught years for the students. This allows us for great opportunities to spiral our content throughout. So I'm going to begin, as I begin, with the students and highlight the issue. So from the get-go, the students are communicated the real impact of the healthcare sector, with 4 to 5 of total global greenhouse gas emissions being attributed towards the healthcare sector, with some statistics going up as high as 7%. This obviously is threatening health, and solutions are necessary. So we introduced these to them early. Solutions such as the HSE Climate Action Plan, aiming to be net neutral or climate neutral by 2050, scoring across 6 main pillars. One, which is very relevant to us, number 4, greener models of healthcare. This is introduced to students very early and spiraled throughout the medical curriculum within RCSI. And that's what I'm here to discuss. I'm here to discuss mainly the education side, ways in which we in public health and EPI have integrated some challenge-based teaching into the curriculum, hoping to have impact later on the clinical practice of the healthcare professionals that we are cultivating. But it'd be remiss of me not to point out just the work in RCSI, some of which Catherine's already highlighted, such as the CHIME network, or our student engagement. For example, in the Planetary Health report card, which we topped the Irish universities on with a score of an A overall. There's a lot of work going on behind the scenes as well as what we do within education. But back to the main topic, I guess. For our education, we have applied, obviously, our spiraled didactic topics, but also we've integrated 2 separate challenge-based actions within our curriculum. The first of which is an elective module, which will hit about 15 to 20% of the curriculum with each student intake. And then is a all-encompassing sustainable quality improvement, balancing quality healthcare and sustainable improvement project all students undergo in their second year of university. We also have available to not only students and staff, but to external researchers or external healthcare professionals as well, a CPD course on sustainable healthcare, which I will advertise at the end for any of those interested. From the start of our didactic teaching, we want to not just promote the bleak, but promote the potential pathways or the avenues we have for moving forward. And the principles of sustainable healthcare is embedded within our curriculum quite highly. Obviously, for us in public health and epidemiology, principles such as prevention go hand in hand. It's very handy for us to promote prevention in the terms of public health, less so for others, such as low carbon alternatives. And that's why we have to also highlight things such as this NHS work, the pathway to carbon neutral, highlighting pathways which will reduce healthcare impacts on the environment, but through different avenues, some of which require innovation, but a lot of which require clinical leadership. And that's where our challenge-based or our project-based teaching comes in to RCSI. The first opportunity students have to engage with this challenge-based or project-based teaching or learning is through the Student Select module. These are elective modules carried out in first and second year of our medical curriculum. Students have 3 opportunities to engage with the Student Select module. So we hit between 10 and 15% of the student body with each given intake year. The Student Select module is an internal implementation of our freely available Sustainable Healthcare online course, and it introduces topics such as planetary health, relationship between climate change and health, sustainable healthcare principles, care pathways, but also the more practical elements such as barriers, facilitators, and stakeholders to green healthcare. This culminates in a group presentation we have students give on wide-ranging topics across healthcare which have the most impact. Some examples of which are inhalers and their impact on the environment, staff travel and virtual clinics, and single-use gowns. So students will come up with 3 novel ways to mitigate these impacts. So it could be reusable gowns in a hospital setting. What would the implementation look like? Who would support it? Who would be against it? How do we balance the health quality that we want to ensure for our patients with the sustainable improvement that comes from things such as reusable gowns? And I think, as Aisling pointed out, we're dealing now with very climate conscious individuals. I feel like individuals coming into current medical, or mostly younger generations in general, are more climate conscious than we were. So I feel like they're just looking for opportunities to engage in actions such as these, or that's what we hope. So the second opportunity they get then to engage in this practical or green-based learning is through our Sustainable Quality Improvement lecture. This balances the maintenance of the healthcare outcomes or the quality of the healthcare received by the patients with other factors such as access and equity, social costs, and environmental costs. And students are asked through this project to also choose any discipline of medicine or healthcare in general and provide solutions to some of the big impactors. So these again are some of the student submitted projects we received. One impacting on food waste or how to reduce the green impact of food waste, and one looking at novel solutions of using alcohol-based scrubbing techniques within surgeries. These type of green actions or green initiatives are what is needed, and this is what we aim to cultivate within the healthcare professionals that we are training. Advocacy is one of the most important things. And as pointed out rightly so in the NHS drive to carbon zero, without clinical leadership, we won't get to carbon neutral anytime soon. So we are aiming to develop or cultivate healthcare professionals that are climate conscious, that want to drive these sustainable actions, but we also want to create these critical thinkers that are developing the methods forward, using these action-based programs to try and create green initiatives and then implement them within healthcare. As I said, we are pushing this more and more, and the need for green initiatives and the need for the next generation of healthcare professionals to be proactive in the push towards green healthcare. We also do want to point out that everyone in teaching should have a responsibility to promote planetary health. It isn't just the next generation that need to be advocating, it's us, and we need to be including it within our own teaching at a very baseline level. And just as a reiteration, RCSI do have our Sustainable Healthcare short course. This is available to everyone with any interest in healthcare or planetary health. It is free. It has CPD credits available to all. And I hope you would take advantage of initiatives such as these. Thank you very much. I'm going to pass over to Graham, who's going to talk about the STEP program within RCSI.
Good afternoon, everyone, and thanks for joining in today. I'm Dr. Graham Kelly from the Department of Chemistry in RCSI, and I'd like to acknowledge the academic lead on this research, Professor Celine Marmion, who is the Deputy Dean for Student Engagement in RCSI, and our student partner is a medical student, Sidonie Chard, fourth-year medical student. And my talk today is integrating sustainability into healthcare education through student partnership. So I think at this stage we're all familiar on the call that around UN SDGs, but just to frame the talk this afternoon, I just want to highlight that the UN SDGs serve as a universal call to action to end poverty, protect the planet, and ensure peace and prosperity for all people by 2030. So does higher education have a role to play in advancing the UN SDGs worldwide? Yes, of course it does, and I think that's why we're all on the call today. And from this, I would like to highlight that higher education and research institutes act as hubs of knowledge, innovation, and leadership that can directly and indirectly support the 2030 agenda. And I think, just as Ross has said, as educators, we have a responsibility to develop students' knowledge and competencies as global and engaged citizens and future agents of change. And there's some literature on that below. So just looking at RCSI's strategy, and Catherine alluded to this earlier as well, but in the context, the RCSI senior management team have a strong institutional commitment to social responsibility and advancing the UN SDGs across education, research, and engagement activities. The UN SDGs feed into the 4 pillars of the RCSI strategy, and action 1 of the RCSI strategy is to contribute to the achievement of the UN SDGs. So just in terms of the RCSI Student Engagement and Partnership Programme, or STEP programme, it was established in 2020 to embed a culture of meaningful collaboration between students and staff. So the programme provides a structured university-wide framework to support co-created projects aligned with strategic priorities like curriculum innovation, sustainability and inclusion. To date, we've had 170 STEP-funded projects with about 650 staff and student partners combined working on them. So while it wasn't a formal requirement, many STEP projects naturally align to the RCSI's UN SDG priorities and the UN SDGs in general. But on the back of this last year, because we noticed this natural alignment, that we undertook a review of the STEP projects to assess their alignment or not to the UN SDGs. We started out by looking at external sources, including generative AI tools like ChatGPT and Copilot. And while they did give us information on projects such as UN SDG alignment, we found that we could actually manipulate the generative AI to get the alignment that we wanted. And in some cases, it wasn't always as accurate as we would have liked it to be. We found that it was very user input dependent, and then the output varied depending on the user. So we also looked at the multilingual large language models, so the LLMs, to help us align the STEP project outputs to the UN SDGs. We found these, however, that they did not really meet our requirements for what we were going to do within STEP. In fact, we actually found that the available language models that we used did exhibit bias towards one or more of the UN SDGs. And during our kind of mini literature review, we found an interesting paper in Sustainability Sciences by Wolf 2024 that actually highlights some of these biases as well. So it's a really good read. So we searched the literature and we want to see what other universities were doing. So we looked at the self-assessment toolkits that the University of Edinburgh and UCC have developed, and we decided to develop our own self-assessment toolbox looking at project alignment to the UN SDGs. So as you can see here, we have 0, which would equal no alignment to a UN SDG. 1, we'd have peripheral or indirect alignment. 2, targeted at a small group level. 3, institutional level. 4, community. 5, national, and 6, international levels. So what we asked our students and staff partners to do was for each STEP funded project last year, so the academic year 24-25, was to grade their projects on a scale of 0 to 6 to each of these UN SDGs. And we also conducted an independent review of them projects, and I self-assessed them to ensure a little bit of rigor around it. And here are some of the results from the self-assessment. So here you can see on the y-axis, we have each of the 17 UN SDGs, and then on the x-axis, we have indirect or direct alignment. Okay, so these are color-coded to the different levels within the toolkit, so from 1 to 6, the levels that I outlined previously. And then the results of the self-assessment is plotted on the bar chart, 1 to 6, and 0. No alignment has been omitted from this chart. Okay, so you can see that the STEP projects are aligning to the UN SDGs and their frequency each at the different levels. So for example, if you're taking the red scores of level 3, which are circled at an institutional level, which would impact RCSI, we have 20 partners rated their project as being aligned to UN SDG 4, 13 to UN SDG 3, 8 to UN SDG 5, and so on. Okay, so we just take a deeper dive into this and looking at it a little bit more holistically. If we take the most frequent alignment of the projects to the UN SDGs, a significant number of projects, as one would expect in a health science university like RCSI, are aligned to SDG 3, good health, well-being, and SDG 4, quality education. And within RCSI, we also have a strong culture of promoting EDI. So again, from our perspective, we were not surprised to see the alignment to SDG 5, gender equality, and SDG 10, reduced inequalities. And then, of course, being the nature of the STEP program, being a partnership program, we had SDG 17, partnership for the goals. So I just wanted to finish by highlighting kind of 2 case studies that shows this kind of integration of the STEP projects and the impact of the STEP program and the direct alignment to the UN SDGs. So our student partner, Catherine Healy, the medical student, along with the head of EDI at the time, Dr. Avril Hutch, had a STEP project titled "To Increase Representation of Clinical Images on Dark Skin Tones to Better Prepare Students to Accurately Recognize and Diagnose Medical Conditions in Patients with Different Skin Tones." So you can see, for example, of this in the image on the right, it is a tick bite. So there's 2 different skin tones, and how the lighter skin tone shows the bite being more prominent. So the students or the STEP partners or the STEP project, they created a bank of over 120 lecture slides, and these are now embedded into the RCSI curriculum. The student partners also gave other staff tutorials on the importance of increasing this representation of diverse skin tones in the curriculum. And I suppose this is a wonderful example of how the STEP program is promoting the UN SDGs 10, 4, and 3 within this project. The second case study is medical students by Julia Martins and a staff partner, Dr. Owen DeBarra, who lectures in tropical medicine. and is titled Empowering Communities Through Student-Driven Global Health Initiatives, the Impact of Chagas Hub Ireland. So just if you're not familiar with Chagas disease, it is a tropical parasitic disease affecting people mostly that live in South and Central America. So if you are from this region or if you've lived there for more than 4 weeks, you're actually not eligible to donate blood in Ireland because of the regional criteria around blood donation. So through the STEP project, the partner set up Chagas Hub Ireland. It's a community clinic that screens for Chagas disease and helps people in these regions get tested for Chagas. So the project aligns with the UN SDGs, particularly SDG 3, good health and well-being, SDG 10, the reduced inequalities, and then by promoting equitable access to health services for migrant communities and advancing awareness of neglected tropical diseases in Europe. This is another really good example of how the Student Engagement and Partnership Programme is promoting and embedding the UN SDGs into the university at RCSI. So I just want to finish off by saying thank you again to Professor Celine Marmion and our student partner, Sidoni Chard, and I will pass you on to Gozi.
Thank you very much, Graham. So hello and good afternoon, everyone, and thank you very much for the opportunity to present this work to this group. Thank you very much, Mark, for the invitation. My name is Gozi Ofaya. I'm Associate Professor and Director of Curriculum in RCSI School of Medicine. I'm also the co-chair of the Race Equality Forum within RCSI. It's great listening to my colleagues, and all the work that's been going through the curriculum is absolutely fantastic. The focus really for my talk now is really just to focus on 2 of the SDGs, which is 5 and 10, around reducing inequalities and gender equity. So I want to focus around reduced inequalities and the work we do within the Race Equality Forum. So we have a new Race Equality Forum. We were the first in Ireland to create a Race Equality Action Plan in 2021, and that expired in 2025. So we've created a second one from 2025 to 2029. There are 6 work streams within our Race Equality Action Plan: leadership, strategy and culture, data, policy report and support, awareness raising and training, education and research, and people. Each of these work streams have a significant amount of work that's been carried out collaboratively with all colleagues around the college to kind of focus on that Race Equality Action Plan. The focus today obviously is around the education and research. So I want to kind of give you a little bit of the work that we are doing around education and research work stream. So the education and research work streams provide an inclusive, excellence-driven healthcare education that reflects our diverse culture and society by continuously improving curricula, exploring innovative teaching methodologies like simulation and case-based learning, but more importantly, championing diverse perspectives in our research as well. So providing the evidence of the piece of work that we want to do. Our education and research work stream has several elements to it. We have the anti-racism reading group, which was created in 2001 when we started our action plan within the graduate entry program, but has now extended. We have diversity in clinical cases. So we've just, and Graham mentioned this earlier, we have just introduced a new curriculum, Ross, a new curriculum. And within that new curriculum, we have case-based learning. And we've started looking at diversity within those clinical cases, which is really important. We have the represent, and I'll talk a little bit about that in a little while. We have faculty engagement and faculty training across the board. And then we have a curriculum review where we actually review our curriculum, specifically looking to ensure that it is very inclusive. And I'll speak to that in a little while. Before I get into the initiatives, into the research element, I want to kind of just highlight some of the previous initiatives that we've had and we've led through the Race Equality Forum. The first is the student-led anti-racism reading group, which I've already alluded to, and this has really gained strength from strength. This reading group was actually created and initiated by students because they actually identified the needs to actually progress this within our curriculum, and this is an area that has now progressed quite well. The paper that they started off with was Fatal Inventions by Dorothy Roberts. And it was a really powerful read around racism and challenges around that, the challenges around those inequalities. Dorothy Roberts, several years ago, 2 years ago, received an honorary doctorate from an honorary fellowship from RCSI because of the work she's done in this area. And during that period was able to kind of provide webinars for staff and students on all the work that she's doing around this area. The Represent, Graham has already kind of spoken to, because this is one that actually came out of a STEP project, which is the inclusivity of skin tone representation in teaching materials. It's quite powerful, and I think the visual, well, the work that Haley and Avril did there is quite powerful, and I think Graham has already spoken to that. Other things as well that we've done is things around sensory room, where we've provided a sensory room in our new building, number 26, for students to actually support them in the piece, support them as they progress too. So including that diversity and then looking at the needs of all the different groups within our schools. We've also had disclosure training, where we encourage people to actually disclose if there's any challenges that they do have and how they could do that anonymously and report things anonymously. And that skin tone research we have continued to fund. So it's continued to progress into the next stages of work. I mentioned the case-based learning and the diversity that we've introduced within that. Not only have we done the piece of work ourselves, we've actually gone and engaged with people outside to actually, all the different groups and different minority groups, to actually make sure that the cases that we create are fully authentic in their own way, and that we do ensure that they are very inclusive to actually help our students. Those case-based learning are done in groups of 12, and students are really encouraged to discuss what it means for them and the representation of what they are seeing and reflecting on that. And I must say, being a facilitator within those groups is quite impressive to actually see students from all different nationalities really coming up with what it means for them and how they are learning through that piece, which is really, really improving. So I think that whole idea of self-reported awareness is definitely increasing as we move on. And then obviously my colleagues in pharmacy, Aislinn's already spoken of some of the work they're doing within planetary health. But one of the things I want to mention around specifically the race equality is around the review of not just the medicine, but the pharmacy and the ATT program, where we've reviewed their slides to make sure that there's no stereotyping, the language is clear, and to make sure that we are fully inclusive in what we're teaching of students across the curriculum. One of the things that we've done is to make sure that what we're doing in reviewing our curriculum, in revising our curriculum, is very evidence-based. And for us, that's really, really important. I think it's very easy to say anecdotally, this is what I've heard around this topic, but it's really important to put evidence through it. So as part of the Race Equality Forum, one of the things we're doing is researching into decolonizing the curriculum. So this is a piece of work that is led by one of our academics, Joan, who's looking at advancing healthcare through inclusivity, equality, and visionary education. So really the aim of the project is really to kind of evaluate how inclusive our curricula is across all of the schools, to gather our staff and student perceptions around inclusivity of our curriculum, to identify needs for revisions so we are evidence-based in what we're doing, but also to support that evidence-based and inclusive curriculum reform. So as we revise our curriculum, that it is fully evidence-based. We went about this by doing a prospective study. So we're in the middle of running this from 24 to 28. We've collected an anonymous survey from colleagues, and we are modeling this for a paper by Ali et al., which was published in 2022 on this same topic. We're using validated questionnaire from that initial published study. We are looking at staff and student perceptions, as I already mentioned, not just in medicine, but in nursing, pharmacy, and physiotherapy. So as a health science institution, it was really important that we have all of the other schools included in this piece of work so that we have a whole holistic university approach to this. We've collected the data, we've used 6 subscales to do that, and the methodology around it will be a mixed method combining quantitative and qualitative data to really give us that deeper understanding of experiences across the key domains that we've identified. For us, I think it's really important to understand where this research sits, and for us, not only does it align with the Race Equality Action Plan, but also aligns with the Athena Swan across the university, but also across the PBS, the School of Pharmacy and Biomolecular Science, Athena Swan. And as already mentioned, obviously aligns to the UN SDG goals. So these is really where we're hoping to kind of pull out the impact of this piece of work that we're doing around embedding diverse voices and creating an equitable curriculum, wider EDI representation, and increasing program relevance for international and diverse students, and promoting student engagement. And of course, looking at the unmet need in medical education, enhancing curricula for better health outcomes. So some of the preliminary findings that we've got from the survey so far, which is a quantitative aspect of it, there's still a qualitative piece to look at, is around the 6 main themes that I just want to highlight: representation, content, peer engagement, assessment, language and communication, and culture. And really just kind of pulling out some of those, it's really looking at some of the things that we're seeing so far is that there's less evidence of inclusive examples in program content. So this is something that we need to look at to see how can we actually pull this and what does it mean for us. Opportunities to engage beyond formal teaching. What does that mean? How do we now introduce this, not just within the curriculum, but outside the curriculum? And that's a piece of work that needs to be done. Some students noticed that there was useful respect and inclusive language within the curriculum and endorsed within the curriculum. And also some of the need to kind of have greater clarity around terminology. So these are still preliminary findings, but ones that would really help us ensure that we are inclusive when we are revising the curriculum, and also more importantly, that student and staff voices are included through evidence in the work that we're doing. So I might finish up there if that's okay, and bring you back to, I don't know if it's yourself, Catherine or Mark, for questions. Thank you very much.
Thanks, Kazi, and thanks everybody. Really interesting. Lots to think about there. If anybody's any questions, they can put it in the chat or the Q&A. I posted some of the links that were mentioned throughout there in the chat and in the Q&A for people. I might pose a question actually just to get the conversation started for the last couple of minutes. And this is to anybody really that can answer this, but like what you seem to have done, which is quite admirable, is sort of hold a mirror up to your own profession and be very transparent about that from the very beginning with the students. And you seem to have achieved that integration that was mentioned a couple of times, vertically and horizontally across the curriculum, which proves to be a challenge institutionally across a lot of institutions. So I'm just wondering, did you meet any particular challenges in trying to do that, or was it easy? So I don't know who wants to field that. Anybody can come in on that one.
I'm happy to take that one, Mark. So, and I take it with my director of curriculum hat, who's been implementing this new curriculum over the last while. Was it easy? I think I'd be lying if I say it was. So I think these things are not easy, but I think it's trying to understand what the concept is, what the initial principles that was designed for the curriculum, and making sure you have people on board with you from that. And that's one of the things that we've highlighted from day one. It's why are we doing it? What are the principles that we're trying to align? And I think that has helped a lot. I think one of the other things that when I started on the role that I completely probably misjudged the impact of is communication. So we wanted to design and completely transformed our curriculum. We had evidence, we understood why we were doing it. We knew it was best practice, absolutely. But I think communicating that to the people that would be delivering it on ground was really, really key. What was the point of doing it? Why did you want to do it? And I think it's bringing everybody on that journey is the part that's probably made it easy. Initially it wasn't easy, but it's made it easy because people now understand you're doing this because X, Y, Z. So it's not just doing this because we've just been told to do it, because it aligns with evidence, it aligns with the best practice, and that's why we're doing it. So I think for us, yeah, we're now going into the implementation of the 5th year within the next next academic year. And it's just been incredible because people are going, oh, that's why you've done this. This is really excellent. It makes sense because it aligns with the principles, with best practice and with evidence.
Yeah, thanks, Cozy. And another question that I think is really interesting from all the presentations is the different approaches that are taken to sort of engage the students. Aisling, Ross and Graham outlined lots of different ways that are very action orientated, underpinned by values, but the students, it's not a passive reception of knowledge, it's very action orientated. So I'm just wondering, and I know you can't speak for the students because they're not here, but from feedback you got and you shared some of the quotes, like how does this resonate with the students coming in? Do they have an expectation that this is going to be there, or are they pleasantly surprised that this is here for them? And again, that's open to anybody who might want to jump in.
I can come in first, I guess, from the projects within year 2 and along the student select module, the elective module. As I was kind of saying, we get students that are already quite at a high end of climate consciousness. They're coming wanting to take action. So when they're given these kind of opportunities, the quality of the work that they put out is really high. And you can tell when you're sitting there watching the presentations or talking to them about their posters that you hope they're not just going to leave it at that. These are people that are going to bring it forward into healthcare in the future, have that kind of critical mindset and aim, hopefully, to implement the changes. We're just giving them the opportunity to actually start thinking about these in a way of as a change agent. And they jump on it, and they genuinely do really enjoy it.
Yeah, I would say the same, Mark, and my colleagues. Yeah, you have, because it's an elective module that I run, you get the really committed students, but also you get some that may not have got their first choice, if you think about it. But it's actually bringing them with you and seeing that transformation as we go through. It's a 9-week module, 1 day a week, 1 morning a week, and that's really rewarding. And and that's what we all want, is to actually see what we can see in others who haven't taken on board, who hear it all, but actually I don't want to hear it, in a sense, and that's very rewarding. Yeah, and I could see people now, if I was on the corridors in college and they came away, if they were walking by me with a disposable cup, they'll start putting it behind their backs because they know, oh no, she's there again. So they have, in a way, actually do it. And they would say it to me. And it's a much different style of teaching and interaction with the students. It's very nice. It's difficult. It's not easy, especially all those adverse impacts on human health by the planet, and that we're responsible for them as well. So it's nudges, I think, as Ross has said, we nudge them along for better care in the future.
Yeah, thanks, Aisling. I think care is the key word. I actually really like the planetary health framework, or I've seen planetary futures, and ultimately we don't have anything if we don't have a planet. Lorraine posted a question there. I think it's a really interesting one. She says, great presentations, great work through service learning with students. My question is if you're aware of any national network on decolonizing the curriculum for staff and students. And rightfully, she says there's actually probably a big opportunity there on that topic area across. So I don't know if there is I'm not aware of one. I don't know, Rosie, if others know if there's one.
No, I'm not aware of one. In the UK, there is. In Ireland, I haven't heard of anyone, any framework yet in Ireland. But no is the answer. In the UK, there's quite a lot, and I think they've done quite a lot of work in this, and well ahead compared to us. Yeah.
Yeah, thanks, Kazi. Yeah, no, I think there is an opportunity there, Lorraine, and something we might follow up on. I'm conscious of time, so again, thanks to everybody who took the time. So it takes time to prepare, and also who presented today. It was really interesting. It's a different perspective maybe than what we've seen in other weeks, but I just think it's fantastic, the work that's going on, and thanks to Catherine for organising everybody and getting everybody there. So just to highlight a couple of things, that obviously the Spotlight Series continues, as I said, to the middle of November. And again, if you want to look back over the session, it's going to be up on the hub pretty quickly early next week. And just a gentle reminder for everybody that we still have an open call for case studies. And I think some of the work today could easily be submitted if people had time. At our open educational resources by the 17th of October, and the template is available. So you just populate the template. It actually doesn't take that much time if you go through the link. And next week, we're looking forward to Maynooth University. So details of that will be promoted through the various social media channels early next week. So thanks again, everybody. Fantastic session, really interesting. Everyone have a good weekend. Thanks for tuning in, and we'll see you this time next week. Thank you very much.
Thanks very much, Ray.
Thank you, Mark.
Bye.
Thank
Thank
you.
you.